2019 to 20 alone, East Metropolitan Health Service cared for over 1,500 patients experiencing homelessness, many of whom were also impacted by a mental health condition. In an effort to improve the wellbeing and health outcomes of these patients, Royal Perth Bentley Group piloted a mental health homeless pathways project aimed at strengthening pathways to accommodation through collaboration with community organisations. Project manager Kat Ahlers brings 20 years of experience in social work, having worked in roles such as child protection, youth services, justice and fostering, as well as extensive experience in community homelessness services.
The 4 key goals of the Mental Health Homeless Pathways project. Number 1 was to identify people coming into hospital, whether it's coming into ED or in an inpatient setting, and identifying these people with no fixed address. The second and third goals were to build up community relationships with homeless services. Number 4 is to train and educate clinicians and health staff within the Housing First model.
Probably around 2 years ago, I realised that there were a lot of homeless patients being seen at a sister hospital, Bentley Mental Health, in the Bentley Mental Health unit. They were not getting the help there at that time that they needed to resolve their homelessness. And in discussion with the Bentley Mental Health Service, the Mental Health Homeless Pathways project was started and has detected and seen over 1,000 patients now in our mental health hospitals and wards.
Some of the great outcomes is that we've captured a lot of these clients on the by name list. The by name list is essentially a database that captures a snapshot of homeless people. So if Joe Bloggs turns up to Royal Perth ED, we look him up on the by name list. Oh, he's got a case manager in Fremantle. The name, the number of that case manager's on the database, so you can call them and get that handover.
The Mental Health Pathways project has been extremely important for the homeless patients that we see at the Royal Perth Bentley Hospital Group. It has opened the eyes, I think, of a lot of staff to just how many homeless patients they're seeing.
I think the Housing First has worked extremely well within this project. We've housed 27 people to date in their forever homes.
Yeah, my name is Gary Lewis. When I was in Bentley Hospital, I got help with home rest, getting on home rest. And I got priority listing too. 50 lives, 50 homes. I should be getting a home soon. A home means to me my own place, off the streets, nice and warm, family.
These are really chronically unwell people, the ones that people think, they're not going to get housed, they won't be able to, be in a house by themselves. But as I said, the proof is in the pudding. 88% of people within the Housing First model in Perth have kept their tenancies and are in their forever homes, so it does work.
Yeah, Kat's a good woman. She's been helping me a lot, get my life on track, and she hasn't forgotten me.
So what I do differently is the through care model, so from hospital to home. I don't close cases, I don't give up on people because they don't engage. As we know with street present individuals, they don't keep appointments, a lot of them don't have phones, no way to contact. So I do a lot of assertive outreach to the hotspots of where these individuals may stay. So that's what I do a bit differently, that whole wraparound and housing first. People need a house first and then you wrap around the supports. It's all around the client, isn't it? And getting the best outcome for that individual. And I think seeing the clients happy, housed, living their best life. The Mental Health Homeless Pathways shows excellence in the way that it surrounds the individual and the individual's needs, and it's very person and client driven. And I think just getting that basic need of a house before you can, unpack some of the rest of life's, difficulties. So I think that's key.